I'm trying to tell you, I feel like women should be madder. Like, I don't get it. Because, like, the more you look into women's health, you're like, bro.
Watching this man recently go down this rabbit hole of gender inequalities in healthcare has been so validating because now you understand why I don't go to the doctor anymore, and everyone always acts like I'm crazy when I say that. What he's saying is correct. Not only are the gender disparities in every aspect of healthcare insane between men and women, but women also end up paying billions of dollars more for healthcare every year than men. So before we dive in, as always, make sure you like, rage, comment, repost, and follow along for more. Yeah, let's start with the obvious one everyone knows, the gaslighting and disbelief of women when they come in with issues. The last time I went into the doctor was because I was having back pain and I was concerned because I have a history of almost every woman in my family slipping a disc around my age. That's why I went in. They wouldn't really listen to me. They didn't take it seriously. They kind of pretended to look at my spine. And then they asked me when the last time I had a pap smear was, which I was confused about. I assured them I did not want one, did not need one, and that's not why I was in there that day. And they guilt tripped me into having one anyways, and then didn't help me in any other way, just suggested I take Advil and go home. And that's because women's issues, women's pain and problems are never taken seriously in the medical field. For starters, most research and test trials historically have always just been performed on men, so we don't really know how women are actually going to react to anything we're being given. Another example of this is HPV for the longest time was not listed as an STD and not taken very seriously because it was stigmatized as a women's issue because it led to cervical cancers. But then suddenly, when they found out that 60 to 70% of head and neck cancers more frequently occurring in men are caused because of HPV, they started taking it seriously and labeled it an STD. In other words, they didn't take it very seriously or start doing a lot of research into it until it started largely impacting males. Another good example of this is the speculum, a medieval torture-looking device that is still used on women here in the US for things like pap smears that in many other countries they've stopped using and they just use cotton swabs like civilized countries. Or like how IUDs are known as extremely painful procedures to any woman who has ever had one. For whatever reason, the medical field is divided on giving women any more than an Advil for it. To add the cherry on top of everything, women in general pay billions more for healthcare every year. We end up spending about 18% more than men on average, and for some reason a lot of the services and things we're offered aren't covered or surpass the deductibles. And yes, women are reported as going into the doctor more frequently than men, but I would obviously suspect that it has something to do with our lesser quality of care we receive. If your problems aren't addressed in one visit, you're going to have to keep going in until someone takes you seriously. And I would highly encourage you look at how the gap widens even more when you break it down for people of color. I studied this for a bit in college and it's concerning because there's even less data and research into this. And it is sad that most of us just don't go into doctors anymore unless it's genuinely serious.